Well, joining me now in the studio is Dr. Paul Keedwell, a lecturer at the Institute of Psychiatry in London and author of How Sadness Survived. Paul Keedwell, what should we make of this study then?
Well, I think it needs to be interpreted with some caution. Some of this data was from an early stage of drug development. One has to question what sort of patients did they recruit into the trials. Having said that, I think there are two main messages. One is that antidepressants should be prescribed for people with severe depression, so people shouldn't rush out and stop them. But at the other end of the scale, for milder depressions, perhaps antidepressants are being overprescribed.
Well, we've often heard that, haven't we? We've heard that people go into a doctor's surgery, they state they have some sort of mild form of depression, and the doctor, just to get rid of them, says, take this.
Yeah, I mean, I hesitate to knock family doctors who are hard-pressed, but I think there is a degree of that, you know, that 4 minutes per patient, it's tempting to prescribe a tablet. Often the patients are requesting the tablets as well, and it's I have to say, a cheaper form of treatment than CBT or other forms of social intervention you could consider. I mean, I'm not surprised that, I mean, this to a degree chimes in with the NICE findings, which suggest that exercise...
That's the British National Institute of Clinical Excellence,
that's right,
which looks into all these drugs. You know?
Yes, finds that talking therapies are as effective, if not more effective, than antidepressants in milder to moderate forms of depression. And that chimes in with my model of depression, if you like, which states that depression can be useful if it's taking us out of a persistently stressful situation that we've got ourselves trapped in.
This study is quite interesting from that point of view about talking, though, isn't it? Because it suggests that one reason it's hard to gauge the impact of these drugs is because the mere fact that patients are able to talk to someone, in this case the doctor, about what's going on,
yes,
immediately makes them feel better.
That's true, and that means that the placebo effect, of course, was quite strong in this study, so that minimises the apparent effect of antidepressants, so that's important to say. And I mean, my clinical experience, people with moderate forms of depression perhaps need both antidepressants and talking therapies, so it's not necessarily either or.
And very briefly, is this going to change the way that drugs are prescribed?
I think it will. I think it will probably reduce the amount that they're prescribed in primary care, and I think there'll be less demand for them.
Paul Keedwell, thank you very much indeed for joining us.
Thank you.